Hi, everyone. Welcome to today's Hinckley Forum. My name is Tiffany Chan, and I'll be acting as a host for today's conversation. The Hinckley Institute of Politics is a nonpartisan institute at the University of Utah. The Hinckley provides an array of transformative experiences for students through internships, forums, and classes. Hinckley forums seek to foster public discourse and civil debate on the most current and pressing issues, bringing in local, national, and international thought leaders. We would like to thank our media sponsor, KCPW, for recording and rebroadcasting our forums as a part of the Hinckley Radio Hour. Today's forum is called Can You Afford Clean Air? And it will be moderated by Ayrel Clark-Proffitt, who is the Sustainability Office Communications and Engagement Manager. If you have any questions, please enter them in the YouTube chat. And with that, I will turn the time over to Ayrel.
Thank you, Tiffany, for that introduction. And thank you to the Hinckley Institute of Politics for hosting our wonderful panel discussion today on Can You Afford Clean Air? And we have three amazing panelists that I'm going to tell you about in just a moment. But first, I want to take just a minute to acknowledge the land on which the University of Utah is situated. So the University of Utah has both historical and contemporary relationships with Indigenous peoples. So given that the Salt Lake Valley has always been a gathering place for Indigenous peoples, we acknowledge that this land, which is named for the Ute tribe, is the traditional and ancestral homelands of the Shoshone, Paiute, Goshute, and Ute tribes, and is a crossroads for Indigenous peoples. The University of Utah recognizes the enduring relationships between many Indigenous peoples and their traditional homelands. We are grateful for the territory upon which we gather today, and we respect Utah's Indigenous peoples, the original stewards of this land, and we value the sovereign relationships that exist between tribal governments, state governments, and the federal government. For today's panel, we are joined by Senator Luz Escamilla, Dr. Daniel Mendoza, and PhD student Casey Mullen. I'm excited to be joining this discussion of policy and research around such an important issue like air quality. And so I'm briefly going to tell you about the speakers' backgrounds before we turn it over to them to tell you about their work. So Senator Luz Escamilla was overwhelmingly elected in November of 2008 to represent Utahns in Senate District 1, which overlays the west side of Salt Lake City. As a senator, she focuses on better schools and educational opportunities, effective public safety programs for all children, and an expansion of healthcare for the uninsured. She is the Senate Minority Whip. She's also partner and chief operating officer of MeCare Group, a Utah-based healthcare startup providing innovative and cost-effective care management, and formerly served as vice president for community development at Zions Bank. She earned a master's degree in public administration and a Bachelor of Science in business marketing from the University of Utah. She's a member of the state's Air Quality Advisory Board and has sponsored bills focused on community and environmental issues surrounding the inland port. Next, I will tell you about Dr. Daniel Mendoza, who is a research assistant professor in the Department of Atmospheric Sciences, and he holds joint appointments as adjunct assistant professor in the Department of Internal Medicine Pulmonary Division, as visiting assistant professor in the Department of City and Metropolitan Planning, and the Nexus Research Institute at the University of Utah. His research interests include quantifying and characterizing urban greenhouse gas and criteria pollutant emissions for use in human exposure estimation and development. He also examines the health effects associated with acute and chronic pollutant exposure, particularly in vulnerable populations. By combining expertise in air pollution, health outcomes, and urban planning, his work aims to produce enactable scientific and policy solutions to address air quality concerns in a just and equitable manner. He's also the co-director of the Consortium for Dark Skies Studies. And last but not least, Casey Mullen is a doctoral student in the Department of Sociology. Her research interests include environmental justice, climate justice, social vulnerability to hazards and disasters, environmental health disparities, and community-based participatory research. Her future research will involve a mixed methods approach in order to examine the impact of air pollution on understandings and behaviors associated with the use of personal air quality monitors. She's also conducted qualitative research on climate change understandings and actions in Southeast Florida. Casey obtained her Bachelor's of Arts at East Carolina University and her Master's of Arts at Florida Atlantic University, majoring in sociology. She has completed training in community resilience for national disaster preparedness at the National Preparedness Training Center, Al Gore's Climate Reality Leadership Corps, as well as climate resilience leadership training in Southeast Florida. So clearly, I am joined by three people with phenomenal expertise, and I am so excited to hear about the work that they're doing and have them share that with you. So to start with, I'm going to turn it over to Dr. Mendoza to tell you more about the research he's been doing.
Great, thank you for the invitation. I will start off, since we're in an academic environment, I can't get away from PowerPoint. I'll breeze through this really quickly because I was only given about 5 minutes. So just want to give you a little bit of an overview of the work that I do, and I'm happy to take more discussion questions afterwards. So we want to be looking at indoor and outdoor air quality as environmental justice markers. And that's something that's important because we keep on thinking about outdoor air quality, but the reality is it's our indoor air quality that affects us the most. This is our 3i research team members. I always like to acknowledge them first because without them, none of this work would be done. We have expertise ranging from political science, mining, artificial intelligence, epidemiology, also pulmonary medicine. This is, I always like to show this picture because it really highlights how much pollution we would be breathing in if it wasn't for, in my case, I'm fortunate enough to have air filters in my home, and you can actually see the differences in terms of what happens really 3 months afterwards during our poor air quality period. So this was done, this pretty much, I had put it in right before Thanksgiving, and I cleaned it up and switched out the filters 2 months later. So how we want to develop equitable and inclusive environments, the model that I've followed has been to either measure or model environmental exposure, then quantify the health impacts, calculate the economic cost, to then develop enactable public policy that will drive urban planning, which could be as simple as should a road be developed near a school, should a factory be moved, etc. And then we can kind of do the whole circle again to then look at what were the effects or how can we model a much better new environment. Well, this is where the circle stopped for me until I started to really think about the fact that the burden of poor quality is not shared equally. And that's when I started to look at this through a lens of equity. Now we wanted to look at the air quality improvement for all populations, specifically and particularly focused on the most vulnerable populations, the populations that may not even know this is affecting them, because while there are many people who are very well aware of the poor quality problems that we face here in the Wasatch Front, many people may not even know that and may not have the resources to ameliorate the situation. One of the major focus study areas for me has been Salt Lake County. And Salt Lake County, as you can see, there's this great east and west divide where the west side has a lower population of white individuals, also lower amount of white collar workers, and a lower income overall. So this is part of what has driven a lot of our research. So this team that I highlighted, we've been working for over 3 years now, but one of our major success stories was really showing how these differences in COVID-19 positive cases were actually exacerbated by the lockdown that was enacted last spring. We can really see how, if we're looking at the lower income group and also the most diverse ethnic group, they ended up with 10 times the rate of COVID-19 positive cases. Many of the factors have to be with the fact that they work frontline jobs, are more exposed, have less protection, and live in multi-generational families. So this actually has brought to light some of what we had in terms of assumptions, but in fact are stark realities that differentiate the social demographic groups. Here was COVID-19, it was really a wake-up call. But again, another really quick example of this is really 4th of July fireworks. We've looked at multiple years of fireworks. Obviously, things were disrupted the past couple of years, but we can see here in Salt Lake City how, because the fireworks are located primarily on the west side, And ironically, not only are the fireworks creating hotspots there, but the clean air is coming in on the east side, as you can see on the bottom picture. That's downwind canyon flows from the Gresham Canyon, and it actually just pushes. So not only are the fireworks at that instant polluting the air, but they're also being compressed and are kept in those places on the west side primarily, and the residents there are exposed to this poor air quality for multiple hours. So many of our work pieces have really developed around looking at the exposure and indoor air quality. There's some elevated air quality events that we've looked at, inversions, dust storms, and fireworks, and also, unfortunately, the large amount of wildfires. So ultimately, and this is some work that I am assuming Casey's probably going to follow up, but we've looked at the educational outcomes, whether it's on test scores, whether it's on absenteeism. Difference is really radically. The red line is more west side schools, the blue line is more east side schools, and we can see how the PM 2.5, what we know as our inversion issues, they are significantly and almost twice as high as on the west side compared to the east side. Finally, when we're starting to look at this really elevated events, if all of you remember, August 6th, we had this huge dust event. We saw how it can even penetrate inside homes. So the black line there is the outside. We've all heard of red air quality. Purple air quality is actually 3 times higher. And we could see how we had those events and it actually even permeated inside homes. Now, in terms of improving sort of our measurements here, particularly on the west side, we've started adding air quality sensors on electric buses are primarily going on west side routes. And lastly, our last project has been looking at black carbon in schools. So there are 2 schools that we've been looking at. As you can see, school 1 has a little bit more in terms of events of poor air quality. We can see those spikes as the fossil fuel readings. We can see that it corresponds to the rush hours. Fortunately, so far, we are actually able to see that both schools are equally protective. You can see the y-axis is the indoor readings. Both schools are basically top off at around 800 nanograms per cubic meter, which is, it's not ideal, but it is much better than, for example, when you can see the X plot, which is the outdoor air quality, which can be up to 3 times higher in some of the schools. So what we're seeing is at least the school buildings are protective of students. Many collaborators and contributors, and this again, this work is really a product of all our energy into looking at social justice and environmental justice. So thank you.
With Casey, as we can say on this research side.
All right. Thank you also for inviting me. I'm really excited to be here. My name is Casey Mullen, and I am a doctoral candidate from the Department of Sociology. I study environmental sociology and environmental justice. Through my research with many collaborators, including Dr. Sarah Graneski, Timothy Collins, Carrie Kelly, and Dr. Daniel Mendoza, who's here today with us, we established the presence of environmental injustice in Salt Lake County with regard to air pollution exposure in schools. My first study local to Salt Lake County measured fine particulate matter pollutant levels at 174 Salt Lake County public schools during 3 distinct events. 1, when the air quality was at concentrations under the national ambient air quality standards or on a relatively clean air day. 2, when the air quality was at moderate levels. And 3, also when it was at its worst during a multi-day winter inversion. We found schools serving predominantly racial ethnic minority students were exposed to worse air pollution conditions during all 3 of the events that we examined. For my second study locally, which included Dr. Mendoza as a co-author, we first examined patterns of environmental injustice and found that schools serving predominantly racial ethnic minority and low-income students experienced worse air pollution, both in terms of annual averages and peak days of acute exposures. Then we examined the effect that the peak exposures had on 3rd grade academic proficiency and found that more days of peak exposures were associated with higher percentages of third grade students testing below proficient in math and English language arts. These findings are important because peak pollution exposures like winter inversions are of particular concern here locally, and the peak pollution levels we utilized in our study were still under the US Environmental Protection Agency standard. In Salt Lake County, we have found that our research connects social disadvantage and air pollution. They're very highly correlated. There is a significant presence of environmental injustice with regard to air pollution exposure for schools serving predominantly racial ethnic minority and lower income students that we really need to address. Currently, I'm working on my dissertation research, and the aim of my dissertation research is to assess the socio-spatial inequalities in the distribution of a non-governmental air quality monitoring network in Salt Lake County. So I am including Purple Air and Air U air pollution sensors in my analysis. And I will use those results to select local environmental justice communities of concern with sparse sensor coverage and recruit families with children with asthma to give air pollution sensors to. This will help expand the local network of air pollution sensors and also help us learn more about people's experiences with air pollution and air pollution sensing. Thank you.
Thank you, Casey. And Senator Escamilla, if you could tell us things that are going on at the state level to deal with these issues, that'd be wonderful.
Absolutely. And thank you. Good afternoon, everyone. It's always a pleasure to join multiple people in academia that are providing us with the data. And, data is the power to, I guess, bring good public policy forward. So this context of having these conversations and really getting to learn more about the different studies that are taking place or research that's being done, it gives us and empowers legislators to run good public policy. So I had the pleasure to work with Dr. Mendoza for the last 4 years and really been empowered with the information and data that he's been collecting. We've done some stuff together. So I guess one of the things I want to start with on the topic of this afternoon's panel is this idea that environmental justice or climate justice or whatever we want to call it doesn't happen in a vacuum. I mean, you really have to understand that for the general public, it's as social determinants of health are hitting their lives, especially to low income and racial and ethnic minority communities. In our case, in the Salt Lake City area or Salt Lake County area is the west side of Salt Lake. It doesn't happen in a vacuum. There's certainly a pyramid of needs, and people are fighting every day to survive. And certainly the pandemic was a really good example of how, we knew it was going to disproportionately impact certain communities, and that happened immediately. And we saw the aftermath of that. So it really, when you think about environmental justice, the lens comes from all the different cultural identities of these individuals. And all of us as residents now, we know air quality does not discriminate based on race, religion, or where you live, but there is, because of social determinants of health, you can see how it impacts different areas. So I've been doing some, work, and I'll just maybe a little bit of a story of how this started for me. I live in Rose Park, so that's where I reside, and I've actually unfortunately developed asthma in the time that I've lived there. Never had that before, and developed asthma as an adult. And I know, in very deep inside of me, that certainly where I live is not helpful for my health. It changed a little bit when the last of our kids at the age of a couple of months old developed asthma as well. She's now a healthy 6-year-old, but for years we had to struggle with her breathing, and certainly bad air quality days were things that were a reality for our family, as we were now, looking into a 1-year-old baby or a 2-year-old baby, and having to pump, and help her with her breathing and getting to her oxygen levels that she needed. So, it really, when it hits home, it changes a little bit of that dynamic. So, but what really got for me was, in 2014, 2013, 2014, the state of Utah was having these really interesting conversations related to waste and waste in the North Salt Lake area. And a group of mothers came together, and they were, many of them living in what you now call the Foxborough area in North Salt Lake. And they were seeing, and they were gathering their own data. I mean, this is why it's so important to understand why data is so critical. And their data was just based on their observations and outcomes related to their healthcare. Many of them related to the number of miscarriages that we're seeing. And, you know, I know there was more information that came out of that, but they started talking about air quality and waste in that area. Now, keep in mind, when we talk about development, and going back to what Dr. Mendoza presented in his PowerPoint, you know, how he has his little, you know, things of steps to get us through a process of how you create good public policy, is, you know, we've been developing maybe 40 years ago when this company was, for example, in this case, one of the companies that was in violation of environmental laws, I mean, really drastically, they were, there was nothing next to them. I mean, so development took place, housing was developed, and schools were developed blocks away from that location, which, you know, makes the question of what was the city thinking when they were doing that, and you know, who was behind, you know, making this planning of these communities, right? And of course, when you move in there, maybe you don't think, oh, let me go and check in the radius of a mile what I have next to the housing. You're kind of like getting the housing that you can afford, right? Because of social determinants of health. Now housing is an issue of affordability, not necessarily what the best air quality is surrounding you. So I got to meet all these women, mostly women mothers, that came with this like serious concerns. And that's when I realized that in the state of Utah, so this is 2014, I run the first bill, SB 64, air quality rules and penalties. I realized that there's only one place in the whole Utah code that the statute of limitation is 1 year. And that is our environmental violation code and penalties. And it was shocking. I'm like, what do you mean? I mean, we do statute of limitations averaging in our code about 5 years. And all I wanted was 5 years, which is the average, right? And I thought, oh, this is pretty reasonable. Well, it was not reasonable. It was not reasonable for the industries. I can tell you that I was probably not in their favorite list of legislators for sure. And my bill died, and it was brutal. I mean, I'm not going to lie, it was brutal. And I've been in the legislature for 13 years, and that was one of the most brutal battles. And I lost that battle in 2014. Came back on 2015, but one of the things that was a unique piece to this conversation was understanding how we, in the state of Utah, address penalties, and how do we even know if there is a violation of our environmental laws. And that's actually self-reporting, number one. And you actually have to have an investigator come to your shop and kind of like, you know, get your log of data and information that you're providing, self-reporting again. And we accepted as a state that our investigators could only do a rounds on all the companies and industries once at a minimum 1.5 times a year, meaning even if our statute of limitation was 1 year and our investigators did the rounds, there was never a way to enforce, because the statute of limitation was beyond that, right? So if you can only do a statute of limitations from 1 year and you were gathering data 1.5 times, you know, meaning a year and a half that you can actually do the rounds in the companies. So that was triggering, and I continued the fight the following year on 2015. I was able to pass with SB 208, and that's the air quality amendment. So what I did, I was only able to increase. So one, what we did is we increased civil penalties against a person who violates the Air Conservation Act, and authorized DEQ to use a portion of penalty money for environmental remediation. We also increased the statute of limitations by 1 year, guys. So I'm sorry, I wanted the 5, I could only get 2. And, you know, so I'm sorry, we actually moved it, and we were able to get it to 2 in the Environmental Quality Code. So we were able to, you know, pass this piece of legislation. And again, just little steps, right? And it's frustrating. Then I got to interact more with Dr. Mendoza, And we were able to work on monitoring data collection, which is part of the studies and work he's done. And we were able to get some ongoing appropriation funding so we can put monitors in the UTA tracks lines so we can get the data that he was explaining and really have an actual way of explaining the impact when you can make a correlation between, like he was explaining, missing school days and children, right? Living on the east versus the west side. And just lastly, of course, I apologize, I'm taking a lot of time, but I don't want to dismiss the conversation of the inland port and why in my district, it's a top priority for any constituent that lives on the west side of Salt Lake City, that its impact will be and is already impacted as we move into implementation of the Utah Inland Port. So in that case, I oppose the inland port. I think it's in the worst location that you can put the inland port. I think if they would have put it 25 miles west, would have been a very different scenario versus where it is. And keep in mind, the inland port is not like just a location, meaning is a port of entry situation and where you're gonna have just traffic, right? I don't know that you're gonna see like a side of people doing transactional stuff. It's mostly just traffic, but you're moving semis, tons of semis, and a lot of trains and other like large cargo situations. So the goal is, how do we electrify it? How do we make it more as less impactful? You will have an impact. Thousands of more semis will have an impact, whether it's noise pollution, water pollution, air pollution, of course, and other pieces. So the only thing I was able to make sure is we were able to get a inland port. I was able to pass SB 144, which is the Environmental Quality Monitoring Amendments. And that basically directs the EQ to establish and maintain monitoring facilities to measure environmental impacts on water quality and air quality. And then later I passed legislation establishing the community enhancement program within the inland port to address the impacts of development on inland port to those communities that will be impacted disproportionately. So I say that because like I said, when I think about environmental justice and air quality, is not on a silo conversation. It really needs to be as a more comprehensive, holistic way of seeing this impact. Thank you.
Thank you, Senator Escamilla. So we do have several predetermined questions for our panelists, and we will then switch over to questions from the audience. So please feel free to put those questions into chat so we can get to those. Senator Escamilla reminds us that air pollution does not discriminate, but we're still talking about environmental justice because there is discrimination that exists in our systems. And the title of this conversation today is, Can You Afford Clean Air? And this reduces clean air, which is essential for our health and for our life, to a commodity. And that's just a really disturbing reality. So I want to ask our panelists, what should we consider when we're calculating the full cost of clean air?
I can jump in here, I think. So again, I do want to really thank the legislators that I've worked with, Senator Escamilla, Representative Romero, Representative Mark Wheatley as well, who have actually really taken, and Representative Joel Briscoe, have really taken this issue of poor quality to heart, either because they do see themselves being affected, their family members or friends being affected, and have given my work some purpose. I think that when we start to look at our academic work, sometimes we're just mired into publishing papers and things like that and giving presentations. But what's most gratifying for me is being able to see the change. And in terms of really answering your question, I can just very quickly say that unfortunately it is clean air is a commodity. How do we must all know friends, colleagues, who probably say, hey, I moved to Park City because I don't really want to deal with inversion here. And that's something that now it's almost become a luxury item, because if we think about how much more expensive it is to live either on the foothills on the East Bench, move to Park City, and then obviously some people that I know have moved to Heber Valley because that area is much less polluted. But what about the people who can't afford to do that? And then we have to start thinking about, well, what opportunities are there I showed that filter picture, which I always like to kind of, it's sort of like the wow picture. It's sort of showing how much air or how much pollution could really be going into our lungs if we don't have an air purifier. And I mean, I'm fortunate that I live closer to the U, which is one of the cleaner areas, but still that air pollution would still be going to my lungs. I mean, I don't know if I should be cleaning out my filter more often. I mean, I do some measurements. Luckily, I do have access to sensors, but not everyone does. So I think that one phrase that struck me was one of my mentors, Dr. Rob Payne. He coined this phrase of the burden of poor quality is not shared equally. And that's something that we need to really think about. And it's unfortunate that not only is it more costly, but it's the communities that know the least, that are least informed, that are actually suffering the worst. And that's something that we really need to start thinking about, because one of the issues here is the education component, is knowing, for example, that you're already in a more polluted area. How else can you start protecting yourself more or protect your family more? And that's really kind of the thrust of this. It's not just necessarily cleaning up the air, which we all want to do, but if you're already in a situation like this, provide the education so that the communities that are on most risk. And perhaps it is a language issue. We do know that communities where English is not the first language typically take about 3 to 7 years more than communities whose first language is English to even be aware of the problem. So that's something that's of great interest to us.
Great. Casey, did you want to follow up on that?
Yes, thank you. So I have prepared a discussion on the costs of air pollution exposure and some factors that impact access to clean air. But of course, my list is by no means exhaustive. I'm committed to learning through community members, students, and professionals each and every day. So if anyone would like to contribute to this discussion further, I encourage you to do so. So to begin with, one of the costs of air pollution is that it causes cognitive harm, and this reduces human capital of whole societies. Anthropogenic pollution causes neurological damage, which stands to negatively impact societal development. Population level impairment can reduce the intelligence and productivity of generations, undermining developmental trajectories of entire societies. Studies have found that exposure to pollution, including particulate matter and hazardous air pollutants, is associated with lower IQ. Prenatal exposures to industrial chemicals have been associated with children's IQ losses of between 4 to 5 points. Air pollution exposures are associated with health effects ranging from premature mortality and asthma to autism spectrum disorder and Alzheimer's. Sensitive groups like people with asthma or other respiratory struggles are especially vulnerable to air pollution. So whether it's kids that are chronically absent from school or adults missing work, their experiences with respiratory struggles have negative impacts on their life, including, but certainly not limited to, their education and their capacity to earn an income. And importantly, as we've addressed, these effects are not distributed evenly. So locally, we live in a mountainous valley that contributes to our fluctuating air quality. When cold air settles in the Salt Lake Valley, high pressure weather systems act like a lid and seal in particulate matter pollution. And elevation matters with respect to that. So the lowest elevations experience higher concentrations of fine particulate matter, and for the longest time, which I think Dr. Mendoza touched on earlier. This impacts residential communities disproportionately. And with respect to race and ethnicity, we must consider socio-historical processes like racial segregation, housing discrimination, redlining, unequal resource allocation, and environmental racism. You may have heard that one of the best predictors of health is zip code. And there are many American cities that are segregated along socioeconomic lines. In Salt Lake County, we absolutely have neighborhoods with higher proportions of people of color in comparison to other neighborhoods, particularly on the northwest quadrant of Salt Lake County. And without a doubt, some of these socio-historical processes have played a role in making these neighborhoods. Air pollution affects people of color and low-income communities disproportionately across the nation, often because there are more polluting sources located in proximity to those communities. So in Salt Lake County, we have to consider the locations of some of our industrial activity, right? The airport, mining activity, refineries, the landfill, and like Senator Escamilla mentioned, the incoming inland port. Also, locations of major roadways and railways and even construction and development contribute to our fluctuating air quality. Dr. Sarah Graneski and Timothy Collins conducted a research locally on social inequalities and exposures to pollution for people of all ages in the Salt Lake metropolitan statistical area. And they found that neighborhoods with higher proportions of Hispanic, Black, and Pacific Islander residents had significantly higher levels of air pollution. Age is another important factor to consider. Children are more vulnerable to the negative impacts of air pollution exposure than adults due to their small body stature, growing lungs, and developing brains. And children spend a great deal of their day at school. If the school is located in an area that experiences worse air pollution on average, they cannot escape that. Of course, income impacts access to healthcare and the quality of care that is accessible. It also impacts a person's ability to engage in individual level preventative measures like Dr. Mendoza was mentioning. So buying and regularly replacing the appropriate air filters for your home, which are more expensive. Buying household air purifiers to keep your indoor air clean, the ability to afford household air quality sensors so that you can know in near real time what your air pollution exposure is like in your home or in your neighborhood, buying the right face mask to filter bad air, and the list goes on. Air pollution impacts everyone negatively, but we see various methods of dealing with air pollution exposure at the individual level, and these methods are not equally attainable. So in summary, these all contribute to creating a cumulative impact, and the impacts are disproportionate. In this way, air pollution or clean air becomes a luxury for some. And if we're calculating the true cost of clean air, we can see that currently it takes various elements of privilege, and it doesn't have to be that way. We can work towards shaping our cities in such a way to decrease the amount of pollution we are creating. We can work toward protecting each and every person from air pollution exposures equally. Decreasing air pollution exposure in areas of concern benefits everyone in the region. And everything I've mentioned up to this point is related to social factors. And so we have the ability to make social change that can help us work toward ensuring clean air for all. A healthy environment for everyone improves everyone's quality of life, and everyone has the right to breathe clean air. As far as addressing the issue, expanding the network of air quality sensors is one way of addressing unequal exposure to air pollution that I'm familiar with, as well as Dr. Mendoza. This enhances our understanding about the variability in our local air quality. Many people are working toward expanding the air quality network here. And by adding more air pollution sensors around our valley, we can observe better through space and time what the air quality is really like, and at a finer scale at the neighborhood level. This can help us pinpoint areas of greatest concern. And in addition to improving the data on air quality that we have, we can work toward empowering community members' voices and validating their lived experiences. By presenting air quality data to community members and leaders for their feedback and approval, we can allow residents to act as the local experts and collaborators that they really are, rather than as subjects or volunteers in research. And including the expertise of community members provides further history, context, and impact. Air pollution data should serve community initiatives toward the solutions that they feel are necessary, as well as inform policymakers, planners, and other community leaders to create a healthy and sustainable community and protect everyone equally.
Senator Escamilla, did you have anything to add, or should we go on to the next question?
Please.
All right, great. I will actually ask this question first to you, Senator Escamilla. But based on our discussions so far, vulnerable populations ranging from kids to elderly on fixed income to unborn children, and to those who can't afford things like healthcare, which I know is near and dear to your heart, Senator Escamilla. Those are the people with the highest risk for poor health outcomes in response to air pollution. So this is true globally, but this is definitely true in Utah and in Salt Lake City, as we're hearing today. So what policies and research are needed to make sure we're implementing equitable solutions?
I think there's multiple legislation that's moving. It all has a price tag attached to it, and it's exciting to hear what's happening. There's some interesting proposals coming for this next legislative session. I'm one of the co-chairs of the Clean Air Caucus, which is the only bipartisan caucus in the state legislature. I believe, been effective under the circumstances, which is, when you have too much power in one group, it's just hard to bring some equity and justice and balance on decision-making process. So that's always a challenge if you're part of the minority party, and if the communities are disproportionately impacted, as described by both speakers before, they tend to be represented by members of the minority party, then you have this disconnect, right? And I think that's unfortunate. But the reality is there are some opportunities with some of the injection of the federal money coming our way on infrastructure, not only through the plan that was just signed, by President Biden, but also the fact that we've had hundreds of millions of dollars that through the CARES Act and ARPA money have been injected to our economy. So we're going to see like this extra set of revenue, which is considered a one-time money that I think could be injected into some infrastructure. I am personally running a very aggressive reduction emissions plan program, very similar to what Texas has done. And mostly, trying to bring some intervention pieces. So you have prevention, intervention, and then like the massive crisis that could need some help. Obviously, funding work that is being done by, as an example, I always use Dr. Mendoza's work because it's very, you're able to bring to quantify some of the outcomes on that. But again, one of the biggest challenge again is, I go back to this idea of how do you get people engaged? How do you get them to care about this when they're thinking how they're going to feed their family this evening, right? And you're talking about air quality, which is even a more difficult concept, even though it may be affecting their quality of life. They may be coughing, they may be getting sick and having, issues related to asthma or so forth, but they can't even think about asthma because they don't have health insurance to go and see a doctor. They don't have a way of pay their rent. So how do we connect this so people actually engage? It's always a challenge. And now gentrification will bring it's probably going to bring a different dynamic pretty soon here, especially in Salt Lake City. So when you say, can you afford, the air quality situation, I'm like, well, just wait into gentrification. I mean, as gentrification continues to happen, which, I think it's horrible. And is breaking a lot of great communities, especially on the west side of Salt Lake City. But affordability in housing will bring gentrification. It's happening already. You're going to start seeing maybe some people that may actually care and have some access to power and be able to, maybe their income bracket will allow them to engage at a different level, or their education, like Dr. Mendoza was saying, to access individuals that are making decision-making lawmakers or others. That would change that dynamic. At the end of the day, when you look at the social determinants of health, and that's mostly the lens that I approach everything that I do in terms of policy, it really then addresses those inequalities and inequities. It's we are still behind, especially on air quality when it comes to our area. You think about, for example, other parts of the country where they're still struggling with water, the drinkable water, right? And it's sad that you're thinking, well, the most powerful country in the world cannot get air quality and water taken care of for their residents. But I think there will be some money. So that infrastructure money, let's put our money where our mouth is. Let's demand from the legislature that, and look, if you ask, depends who you're asking, but if you ask certain individuals in the legislature, they'll tell you, hey, our air quality is better now than it was 60 years ago, if I hear that again. And it's like, oh, wow, that's the threshold from 60 years ago. Like, I mean, we then move into a tier 3 conversation. Yeah, but not everything that's in Utah that is being utilized is tier 3. I mean, because then you get into the credits and, these other pieces. Well, then we move into incentivizing programs, right? And those are the interventions I'm talking about. So yeah, now we have the carrot program where we incentivize people to get rid of their, certain type of vehicles or others that may be polluting more. Well, let's put more into those incentive programs, which will be my emission reduction program plan. That requires money. Let's put the money there. The inland port, man, we better get it right? I mean, if we, with all the information that we have, with all the monitoring that we're doing now, with $50 million that the federal government gave to USU to bring, to electrify it as much as we can on the inland port, that inland port better be the best inland port in the world, because if not, then right. And that's the scary part. Like, what are the chances? I'm sure there's going to be a lot of mistakes. Let's just keep an eye on them. Let's educate people in a way they can understand so they can engage at a level that they feel comfortable, because it is about their future and their kids' future and their grandkids' future, right? I mean, this is a long term, guys. I mean, we may be okay. We, like the ones that are right now participating on this panel, but our kids and our grandkids and our great grandkids, they're going to have a very different scenario.
Yeah, absolutely. And the air quality might be better than it was 60 years ago, but we also know a lot more about how that impacts our health.
Yeah, no, please, I need to take you if I hear that comment again. Yes, it happens all the time.
Take Dr. Mendoza or Casey, they are the experts on the research side. So we are getting a little short on time. We only have 14 minutes left, and we've had some audience questions. So I'm going to ask the final moderated question because I think it's a valuable one to think about. And then we'll move forward into the audience questions, which are also really interesting. So the air quality problems in Salt Lake, as we've talked about, they're not happening in a vacuum. As we saw this past summer, the wildfires in the West led to Salt Lake's air crisis. Air pollutants contribute to climate change, but climate change also contributes to air pollution. So what compounding effects from climate change can Utah prepare for now to protect its communities? And Dr. Mendoza, I know you have some interesting feedback on this, so I'll turn it to you.
Yeah, I think that we need to really start thinking about, as you just mentioned, that these air quality issues do not really happen in a vacuum. Now, air quality is a more localized phenomenon, but climate change is a more general phenomenon. And as we saw, most of those wildfires were not really originated in Utah. They were from other more Western states. And I think that what we need to really think about is working together with across the US and with other countries as well. These wildfires, again, they are a result of our changing climate, drier, hotter summers, and even warmer winters. We may have all seen in the news how almost all of the ski resorts this year have postponed their openings 1 to 2 weeks simply because of just the change that we're seeing. So what we really need to be very aware of is that, again, while our air pollution does cause issues in a more local level, it does eventually drive some of the climate change, which then impacts everywhere, the entire world. Some of the really most drastic events, and that's something you just touched on, Ayrel, is the wildfire proliferation. One of the figures that I scrolled through just showed how bad the wildfires can be. That August 6th event, we couldn't really see outside our homes, and we could actually smell. It was almost like we had a cookout inside our homes, and that is a really dramatic problem. Again, when we look at climate change, we also have to think about such impacts as drought that we are experiencing right now. The Great Salt Lake, I just saw a terrifying statistic that it has dropped 8 inches from August till early November. It's dropped 8 inches. And what that's doing, it's also exposing lake bed, which then is exposing heavy metals. We know that's a huge concern, particularly for the Northwest Quadrant, because those heavy metals will travel much less than, for example, the PM or the ozone or any of these other contaminants. That's going to directly affect those neighborhoods in that area by the inland port. So we need to really start thinking about what are these impacts and how can we start to mitigate them? Now, Utah cannot change or cannot stop climate change on its own. We can't do that. But there's a joint effort that needs to happen across other countries, across other states. And that's something that we really need to start to consider. And unfortunately, some of the work that we're doing, that Casey's been doing, Drs. Gurneski and Collins have also been doing, is really starting to quantify what is the monetary cost, or what are real indicators that we can actually take to the state legislature. What, for example, when we look at student absences or lower standardized test scores, that can be monetized. And that's something that we can say, look, this is the cost of inaction. If we do nothing to stop this train, this is going to happen to the generations following us and for us as well. So that's something that we really need to be putting into consideration when we start to discuss all of these compounding impacts.
Thank you. Senator Escamilla. Casey, anything briefly to add before we move on to audience questions? Okay. So the first question that I have from the audience, is it possible for policy to use competition in the market to drive down pollutants by using fee revenue to remediate all of the added healthcare costs and environmental impact from air pollution? I will also put this in our chat too, so we can read it.
I am not especially informed on this, but I know there is a University of Utah student who did quantify the amount of money that we would save, I think, by expanding healthcare access to people in Salt Lake County. And it was like they compared the costs on our healthcare system without having everyone have access to healthcare, and like thinking about air pollution and how it exacerbates respiratory issues. And they ran numbers and discovered that we actually would save money if everyone had access to healthcare in that regard. And I wish I remembered their name. I will work on finding out the student's name.
Great. Other thoughts regarding that as a policy, as a market-driven solution?
I mean, we incentivize, right? I mean, so incentives is kind of like the, I guess, it's a carrot versus a stick approach. And just based on our political climate in the state of Utah, mandates are not very popular. And, market-driven solutions seems to what people like to say. I sometimes don't necessarily agree that those are the best approaches, but yeah, I mean, like I said, I mean, like the emissions program that I'm working on is mostly incentivized driven, so all incentive driven, most of it. But I also think you need some enforcement mechanisms. I mean, when your fine is pennies to what you're making, you'll pay the fine. And we've seen that with a lot of, violators and polluters, where they almost laugh of those fines. And that's frustrating. So, I mean, definitely, I like the idea of competition and market driven, but at one point, it's all kind of like relative to the type of, industries that we're talking about, I guess.
Absolutely. So the next question that came in from the audience was, if pollutant contributions are self-reported, that seems to be a conflict of interest. Would it be feasible to make industry justify being charged less than a max standard fee through self-reporting?
And it was the same concept. I mean, it's just, so the question is, in terms of enforcement, is the infrastructure that you need to enforce something. And, we see it in law enforcement as well, right? So the people are speeding, I mean, if we were to actually ticket every speeder out there, there will be a lot of tickets, but you don't have enough, police officer or highway patrol officers to do that. It's the same when we have this issue. And yeah, it's unique into the self-reporting. And by that, I mean, so they're, my understanding is not like they're making up the numbers, like writing them on a piece of paper, like there's somehow a way of that, but where they could be change or, alter, I guess. But it seems to be the standard of how this thing happened. I mean, I was kind of like shocked. I'm like, okay, wait, what do you mean say what? And so I think in the case, for example, we've had this very public case of that, the waste and the way we were handling waste. This was actually medical waste out of all things. That was, and they were burning the medical waste, and that was creating this massive problem, and the public was driving a lot of that. I mean, public shame is very powerful, guys. So I mean, as we're having this conversation of a more law enforcement legislative approaches, I've learned that public shame is equally heavy and sometimes drives changes faster than some of the legislative changes. Not that it takes away from the responsibility of good public policy at our legislative levels, for example, but it's another idea to consider. I mean, if we start demanding and we start consuming, products or services from companies that are responsible, I think that also makes a big difference.
Yeah.
And we have to understand that as well, that self-reporting is not necessarily, as Senator Escamilla just said, no one's just writing things down. Factories and industry have to go through a process. They have to specify what their actual activity is, and they have to specify how much of a certain product they are actually processing. That is all found through, for example, tax records, certifications, annual certifications. So we can't just say, oh, they're just self-reporting. That means that they're not necessarily being formally audited, but they have to do this. It's almost like how we're doing our taxes, right? Some people can get away with it, but the reality is that most industry really is they're trying to do the right thing.
Good clarification. All right, we have one last question that's come in from the audience that I think we have time for, but we'll have to be brief. What is the best way for citizens, or maybe people at the University of Utah, given our audience, to become engaged in this debate and push forward good policy?
I'll jump really fast. I think, I get this question all the time on multiple issues, right? Redistricting a week and a half ago, which we're still dealing with PTSD from that. But one of the things I think that's critical is people say, well, I live in Salt Lake City, my legislators get it, and maybe some of them were mentioned before, and that's great. Well, then you may have family in Utah County or Davis County where you have other legislators that may be not there. And that commitment is, can you call 5 people that that are not in your district to connect with their legislators? If you're already connected with your legislator, you're already there. If you know your legislator, if you even know who your legislator is, you're like, 50% into how, where we need you to be. But getting the 5 other people to do it, I mean, it's like, this is a number issue. Let's just get our numbers together. Let's bring awareness. So if you're committed to saying 5 more people that I will, in my circle, in my universe, that are not maybe in my district, that I can, talk to them and say, hey, can you connect about this issue? Find a bill. You can track us at le.utah.gov. We have a great tracking system on legislation. And please just visit also our Cleaner Caucus's Facebook Live every Tuesday of every month. The third Tuesday of every month, we're meeting and, talking about these issues. You can watch us on Facebook and watch what we're talking about and follow those bills. Thank you.
Great. Any last advice, Casey, Dr. Mendoza?
I think it's just becoming educated and then just realizing again that as Senator Escamilla just said, that public shame can actually be a significant driver. So if there's a group of concerned citizens, a group of concerned people that want to try to make a change, work with your elected representatives. That's what you elected them for, so they can represent you. But then also make sure you if you are interested and you do have good points and you do have the basis for it, make sure your concerns are heard.
Great. So we are out of time. This has been such a fascinating discussion. I would love to keep going, but unfortunately we cannot today. So I do want to thank our 3 panelists. That was wonderful. I also want to thank the Hinckley Institute of Politics for being our hosts today. Just so everybody watching knows, this will remain on the Hinckley Institute of Politics YouTube page, so you can revisit this if you wanted to look back on some of the information, and please share it with your friends. As we've said, you have to talk about these issues with others and get them talking to others so that we can actually make a difference. So thank you very much.
Thank you. Have a great day.